Myth number 2. A single-payer system would subject doctors and other providers to onerous bureaucratic regulations. In fact, nothing could be more onerous both to patients and providers than the multiple intrusive regulations currently imposed on them by the private insurance industry.
31 cents on a dollar spent on health care goes to something other than health care, and that's a problem. This happens because people are hired specifically to prevent their employer from paying the bill. In fact, an entire industry is based on that task. They're called insurance companies. They do not deliver health care. They do not heal. They do not prevent disease. They make money not providing health care.
Blue Cross agency in my state employed, last time I looked, 6,192 people. That's to administer coverage for 2.5 million people in the state of Massachusetts. The Canadian National Health Insurance Program employed fewer people than that to administer coverage for 28 million Canadians.
People do wait in Canada for medical care, but do you know who decides who waits and who goes first? Physicians. It's a clinical decision, not a pocketbook decision. We have people waiting in this country forever because they don't have the money.
Patient care in this country doesn't pay. Let's face it. That's not where the money goes. It's diverted to profits, marketing, administration. It is not being used to pay for patient care. And that's what single payer promises to change, and that's why we're in the forefront of making that change possible.
It is time that we stop funding the insurance industry profits and started providing care for the public that deserves it.
This is in defense of the health insurance industry. I want to say a word on their behalf. Because they are publicly traded companies, our laws require that they maximize their profits for their shareholders. They have a fiduciary, right? That's what the law says, a fiduciary responsibility to maximize profits for their shareholders. The only way that they can maximize those profits is to deny care.
The good news is that universal health care has been accepted as a goal by most mainstream politicians. The bad news is that they define it simply as requiring that the uninsured buy private insurance. The true objective seems to be to save the private insurance industry, which adds cost to the system but contributes no value at all. It's a parasite, in my view, on the healthcare system.
So many people are saying, well, we have a solution. It's to provide more subsidy for the insurance companies. The insurance companies make higher profits. Well, that's not an adequate response.
President Bush has said we need tax subsidies to help people buy coverage. And Mr. Colbert says it's so simple. Most people who can't afford health insurance are also too poor to owe taxes. But if you give them a deduction from the taxes they don't owe, they can use the money they're not getting back to buy the health care they can't afford.